Good afternoon and welcome to our beautiful webinar. What's better in this world than a beautiful smile? Whether we are encountering happy moments during our lifetime, sometimes sad moments, challenging situations, challenging times like we are witnessing right now, a beautiful smile will always come to highlight everyone's path, to build great energy around us, to help us keep on going and to keep inspiring ourselves and the ones around us. Today, I have with me, and I have the pleasure of introducing two of New York City finest doctors. I do have Dr. Michelle Zweifler, board-certified plastic surgeon with a gorgeous medical spa on 61st and 5th Avenue. And I do have the fantastic Dr. Steven with his wonderful Luxury Dentistry, New York City on the Upper East Side. They will help us to figure out what can we do to enhance the beauty, the physical beauty of our smile as well. Aside of the fact that it's coming from within, we also have to ensure that the physical appearance matches the interior. So welcome to the webinar, Dr. Zweifler, or Dr. Z, the way her patients call us, and Dr. Steven, the way most patients adore to call you. How are you today?
Doing great.
Dr. Steven, both of you are showcasing gorgeous smiles, which is quite inspiring. I would like to start maybe with Dr. Steven. How do you feel these days? I know the practice has been booming during the last few weeks because patients were eager not only to get their treatments, but also to see your beautiful smile. So tell us, how do you feel these days about your work and what adjustments did you have to make in order to ensure the patients are safe and happy?
Yeah, so we're chugging along full speed ahead. We're thankfully extraordinarily busy. As you mentioned, many cases that we had to push off during the pandemic, we're finally getting a chance to get back to. And people have time now to do things that they were thinking about. So extraordinarily busy, full schedule, but we're keeping the highest standards of prevention, cleanliness, and care at the office at the same time.
So I would like to highlight that I had the pleasure of actually visiting Dr. Steven for my dental cleaning, and the experience was fantastic. So I'm eager to come back for my Zoom whitening or other procedures you think I might need, including Invisalign, because we know my teeth are not perfect. So now, Dr. Z, tell us, I visited you as well. Tell us, how do you feel these days about your interaction with your patients?
Well, first of all, you have to love the smell of Lysol and hand sanitizer. But unfortunately, you miss my smile and my staff smile because we are covered under usually an N95 mask and maybe a surgical mask on top of it for our protection, for your protection. But otherwise, we're back to business. We're excited to see our patients. We've missed everybody. And unfortunately, the smile is a little hidden right now, but it doesn't stop my patients from coming in and wanting their face to still look good and better than ever.
Including myself, because I went to Dr. Z for my fix, for my Botox, because I'm on Zoom camera, and for a few months I was terrified of seeing myself, and I was so excited to go to Dr. Z and get my, how is this called, 11? The 11th, right?
11s, or frown lines, 11s, glabellar.
Because we can't have those on IG Live and on my Zoom meetings, it's not chic. So let's get back now to Dr. Steven. Dr. Steven, from your perspective, and now we are going back to dentistry, to art of the dentistry, what makes a smile beautiful from the technical perspective?
So, I mean, a beautiful smile, it just means so much. The level of self-esteem that patients could get and the confidence that they exude when they have a beautiful smile, and being able to deliver consistent and predictable, beautiful smiles to my patients, it's what drives me to work every single day. Number one of what makes a smile beautiful is the foundation. Can't forget about the foundation. You can't build on a poor foundation. So we're looking for healthy gums and subsequently healthy bone, and of course having healthy, strong enamel or your teeth. And this takes good oral hygiene, right? Good practice. proper diet, regular maintenance visits at your dentist and hygienist. Usually for most, that's about twice a year. As far as what makes a beautiful smile when we are creating one, once we have that foundation down, we're looking at symmetry. We're looking at both facial symmetry as well as dental symmetry. Asymmetries, when somebody comes in, they're pointed out not to be rude. They're pointed out to showcase what a smile can and cannot do within the frame of the face. So many times on an initial evaluation of a smile consult, and somebody comes in and says, I just want a beautiful smile. Again, not being rude, I'll point out asymmetries of the facial structures, of the lip lines, of the musculature. Many times I will hand a card or a referral card to discuss with a plastic surgeon about lip augmentation procedures or fillers or the like. Because obviously teeth is a part of a smile, but there's a lot more than teeth to a smile.
And actually, you mentioned something to me when I did my dental cleaning. You say that I had a small imperfection in my enamel, and you say, luckily you have full lips and they concealed that. So now we are getting to Dr. Z. Dr. Z, tell us, how can beautiful lips enhance the quality of our smile, and what can you do to make that, appearance even more beautiful?
Well, it's not just about the lips. First of all, facial anatomy is so important, and the lower part of the face is what we're going to focus on today, and everything's in proportions. So when it comes to lips, we want our lower lip to be larger than the upper lip. That's part of proportions. We want symmetry between the right and left side. But it's not just that makes the smile. There's a thing called smile lines along, which we call medically the nasolabial fold. And from so much smiling, we lose collagen, we lose elasticity, and our cheeks come down at this natural crease. So part of a smile is softening this crease, whether it's lifting up the cheeks or directly putting filler here. Same thing, no one wants to be like a puppet, like a marionette, and we see these lines coming down. And the downward turning of the mouth could be improved with a couple of things. One, you can put some filler directly here to soften it. Two, the muscles around the mouth, the depressor muscles, will pull down and give that sad look. No one wants to look sad all the time. So sometimes putting a little Botox in the depressor muscles could help soften that downward turn and give a better smile, like a perma smile. And also we get lip wrinkles around the lips, what we call smoker lines. So Botox or filler could help soften those lines. And some people have a pitted chin, and by using Botox, we could soften that. Then there's the lips and the teeth. I grew up, my dad was a dentist, so we were all about nice, white, smiling teeth. But we do lose volume of lip. We lose the red part of our lips as we mature, both men and women. We get lengthening from the nose to the lips, and fillers could help restore that. So when I talk about a smile, I'm talking about the lower third of the face, the whole area around the mouth, including the lips and the teeth.
I actually remember that I was in your office a few months ago, and one of the patients, she was so excited. She said, look, I smoke and now you can no longer tell. Right after treatment, she said, aren't my lips gorgeous? And obviously she got the treatment. I witness your work quite often, and I'm always mesmerized by it. So now getting back to Dr.
What, Vivi, I'm going to add on that. You mentioned about collagen. We're losing collagen as we are expressing our facial expression, 100%. What we also lose on the tooth aspect, as we are aging, teeth will get shorter and shorter from use. Right, we're rubbing up against an adjacent tooth on the bottom, and we're losing some of that size, the contour. And what we're looking for when we're designing a smile within the frame of what was just explained of the lower third of the face, we are creating this smile line. It's this imaginary line right at the tips of your front teeth. And we want to mimic with that. If we want to rejuvenate and make it more youthful, we actually want to follow that the lower lip. It's the wet dry line of the lower lip when we're smiling. And when we smile, the curvature of that lower lip kind of follows my finger. And therefore your teeth in the front should actually be a little longer. And we shouldn't see is your canines being longer than your forefront teeth. So many times a combination approach of getting everything back up on the face, on the teeth, we actually want to bring down. So we're seeing that youthful smile again.
This is so fascinating, and it's so educational because none of us are aware of that. Sometimes we go to the doctor and we have our own perception about what we want, but we should listen to the experts because there are those little significant details that will make the huge difference in the end. Dr. Steven, everyone, after my IG live with you, everyone was DMing me, what is this Zoom whitening and how can we get white teeth, those Zoom white teeth? Tell us about it.
Sure. Zoom has been around for a long time in dental offices. They keep advancing. So there's all different levels of Zoom whitening. The one we're using is called the Zoom White Speed. And the reason why it's called the White Speed is because now it's using an LED light, which is actually going to be kinder to the teeth, so less sensitivity, but we're actually getting better, faster results. It typically takes about an hour in the chair. We're using Zoom gel, which is a hydrogen peroxide of over 30%. So it's a very strong hydrogen peroxide to break down the chromophore, which is a stain molecule. So it's not a Benjamin Moore paint. For somebody that's looking for paint colors and wants to pick out a certain white for their teeth, that's not teeth whitening. But teeth whitening, what it will do is it could decrease what we're seeing, what our eye is visually able to see as a stain molecule. So those who have more yellow teeth from coffees, from tobacco, red wines, we're getting tremendous results because that's stains that we're able to break down in that hour, and it just looks amazing. For those that have more of a dull kind of gray tooth, sometimes it's an aged tooth, we could still get a result, but again, we're not able to get it to that Benjamin Moore white that you might pick out for your sailing. In those situations, we talk about covering the teeth with porcelain veneers, bonding, and a bunch of other cosmetic procedures that we do.
I actually have one tooth like that. My teeth are white and one has been stubborn for years, and I think I have to come and see you and we just need to figure out what we do about the gray tooth. Now, Dr. Z, getting back to Dr. Z, what makes lips beautiful?
Well, I mean, it's variable because different cultures and different ethnicities have different lip contours. But what makes lips beautiful is some degree of fullness. You don't want necessarily too much fullness and look like a fish or a duck. You want just the right amount of fullness and proportion. You don't want wrinkly red lips. You want the lower lip larger than the upper lip, usually around 40% to 60% differences between the upper and lower. But you want nice contouring. You want Cupid's bow in the focal column, like what I always call the M for patients because it's easier to explain that. You want that to be defined. You don't want to obliterate it and be rounded with fillers. You want it to be nicely contoured with sharp definition. And that's why when people put lip liner on, they're lining it in a sharp way. I'm not even getting this all in, the sharp way of the lips. So we're trying to mimic that with our fillers. Initially, we did just along the vermilion border, which was the line between the red and the white. And that tends to give a little bit more of a puckered out approach. Now, we're doing a lot of filler using the red portion of the lips for more natural contouring. But a lot of it, is beauty is in the eye of the beholder. And, it's one procedure that I actually give a patient a Q-tip. And I'm like, do you want more? How do you want it? I want them to be involved because at the end of the day, they go home, they look in a mirror. I don't want them to leave looking ridiculous, but I want happy patients. And there's always going to be some swelling for the lips.
So it's pretty funny because most of you that joined us today don't know, but Dr. Z has a very healthy sense of humor. And I was teased as a child because of my lips. I have very big features. My eyes are big, my nose is prominent, and I lost track of how my lips look like because when your entire life you think your lips are big. And I went to Dr. Z a few months ago and I said, Dr. Z, how are my lips, small or big? And she said, they are definitely not small. And I thought it was so nice the way you said it in a way that it made me feel good about myself. It didn't offend me, but definitely not small. So you can count on Dr. Z to be 100% honest and also not to hurt your feelings. So now getting back to Dr. Steven. So the more I do my Zoom meetings and IG lives on a weekly basis, I notice that my lower teeth are, let's say, not that pretty looking. So let's talk about Invisalign at any age, because you mentioned to me there's no age group that people are coming, especially now more than ever after seeing themselves on screen. Tell us a little bit about the journey, what it entails, and how long it will take until we are able to see some valuable results?
Yeah, so teeth shifting and having misalignment is something that will occur throughout one's life. So there isn't an age bracket where one starts to be inflicted with crowded teeth or a not straight smile. There is something called a retainer that is used at the end of any teeth straightening to hold the teeth in the proper position so that somebody doesn't relapse back into having a misaligned smile. So therefore, those that have had orthodontics when they were children or at a younger age, and if they stop wearing that retainer, they are now a candidate again to straighten their teeth. So that's why the age really doesn't play a role. Age plays a role though in health, right? So going back to the foundation, you need a healthy foundation. So if I have a 72-year-old who has bone levels of a 45-year-old, and they have plenty of my patients are there because they were maintaining their teeth, I can very safely straighten her smile. I could do the same for my 13-year-old patients and my 25 and 30s and 40s and so on. So therefore, it's not really the age barrier there. It's become so easy for adults to have their teeth straightened because it used to be, yeah, you could straighten your teeth. It'll take 2 years. You have to put this metal back on your teeth with wires, and don't worry about it. People in work won't be staring at you. And yes, they would. It just didn't match the timing for that person. And they're going out into the world, they're getting jobs, and to have metal braces was a big turnoff. And there were other issues with regular braces as well. It could increase cavities. You could get food stuck into it. It could hurt the enamel. It could cause sores and irritation in the mouth. What do we have today? We have something called clear aligners. So clear aligners are pieces of plastic to move teeth. It actually is not so new. It was back in the 1960s that some dentists were using plastic to move teeth. My father was actually one of the first to train people in the 1980s on making plastics yourself at home. But now we could use these plastics on almost every type of case, where instead of braces, we could go to these clear aligners. And a big advancement was a company called Invisalign. Invisalign had an amazing smart program that was able to predict the tooth movement before they even happened. So we're able to make up all of these clear aligners in advance, which means less appointments. People don't have to come in for constant molding of their teeth and making up these devices. Instead, we could actually treatment plan it on software and give these aligners to the patient. So the journey is typically coming in to see me, making sure you're a good candidate and you have a healthy enough smile that we can now straighten. And we do something called digital impressions. We're taking an impression of the teeth without trays, without goo. It's basically a video camera that takes 3 minutes, just going around the teeth and getting a good capture of the gum in the teeth. We then treatment plan, send it out to Invisalign. A few weeks later, you're coming back. Sometimes I'll be placing small little clear attachments on the teeth to help aid the tooth movement, teach you everything you need to know about the aligners. And then periodically, I would ask for you to come back. Not every time you're changing the aligner, not per week, but every now and then to make sure things are tracking well and that you're doing a good job. And then at the end, as I mentioned previously, is the retainer, which is a great piece of plastic you wear at night to keep the beauty of that straight smile going to decades and decades and decades and decades down the road.
It's also very important to say that there are a lot of companies out there. I'm not going to name companies, but they guarantee smiles. I don't know, you don't go to the doctor, you just go to an office and an assistant. I would say that expertise comes first. And from what I do work with doctors, and I'm aware of how long lasting the results are when we go to the right specialist. So when it comes to Invisalign, don't look, everybody who follows us, for a good price. Look for the expertise of the doctor. Look for someone who understands the anatomy of the face, who's a doctor, a real doctor, not all kinds of practices. So Dr. Steven, I was very impressed actually when I had my dental cleaning, because your assistant mentioned I'm a great candidate because my teeth are in great shape, which is right, goes back to saying that it will make the process easier. Now, going back to, thank you so much for this valuable information. I truly believe that now more than ever, you will have patience because we all see the disaster on Zoom and on webinars. So going back to Dr. Z. Dr. Z, I would like us to talk about Restylane Kiss, spelled Kysse, which is the most innovative and newest filler for lips.
Well, Restylane came around originally just the regular Restylane. It's hyaluronic acid, which is, most of our skin is collagen, but a small amount is hyaluronic acid. It's in all species, so it's pretty constant. So very rarely, so I'm going to have some weird allergic reaction. But the Restylane, it brings some water. Juvederm, which is an Allergan brand that makes Botox, they have even a little bit more water. It's very hydrophilic, and your lips get very swollen. And what they've done with this is try to get too much swelling away and too much hardness or thickness away. And with Restylane Kiss, they're trying to make a softer product because your lips are constantly moving. So you don't want something that's stiff. You want something that moves with you. I don't know, longevity because it hasn't been out that long. All the manufacturers say it lasts up to a year. I find for fillers, most of them last about 6 months. People that talk a lot like myself, I don't get a full 6 months, and everyone's metabolism is a little bit different. But I usually say it could take about it, it lasts usually about 6 months, maybe up to a year.
So it's basically, Dr. Z, case by case. Every patient is different. Then also fillers, I know from speaking with you prior to this, every person responds to the same filler differently as well, right?
Well, a little bit, because we're all unique. We all have different anatomy. So when you come in with a picture of a lip from Instagram of some celebrity, it doesn't mean I could get you to that person because your actual, lip isn't designed that way. Yes, I could add volume. I understand what you're looking for and what you're desiring, but there's no guarantee that you could be somebody else. I mean, we all are unique, whether it's our lips, or the rest of our face. What makes us beautiful is that we're all different, and that some of these asymmetries actually make us more beautiful. When they show the split images, and they take down the face and they put together 2 right and 2 left, and versus together, sometimes the together looks better than the other ones in most individuals. So anyway, and I just want to say one more thing that I didn't mention before about teeth, because it all ties in hand. There's a lot of people that are anxious and stressed out, and they grind when they sleep. They're constantly grinding and ruining their perfect natural teeth, their veneers, they're bothering whatever they've had done to their teeth, and they're ruining it. And I happen to have gotten really into the last several years of doing some masseter to the Botox to the masseter muscles. And Botox to the masseter muscles, you can still eat, but it just softens the muscle, and that creates less grinding, less pulling on the TMJ joint, and it gives some slenderizing of the lower face. So I didn't want to forget that while I was thinking.
Great, actually, the jawline. So Dr. Steven, talking about grinding, what do you do yourself for patients who are grinding their teeth?
Yeah, Dr. Z, that was a great point. What I do for many of my patients that I do smile makeovers for, if the cause of the asymmetry and the problem that was there had to do with shortening of the teeth from grinding or from really strong masseters or muscles of mastication, we're typically advising them to return to the office every 3 to 4 months for the Botox of the masseter. Great thing about that is that my work doesn't get destroyed by those powerful muscles. We also, as Dr. Z just mentioned, we can actually see slimming of those masseters. So it's a slimming of the face. And in addition to that, we're also covering these beautiful veneers with a night guard, which is a piece of plastic, has a little bit of softness to it. It envelopes the veneers and the teeth. It helps relax the jaw muscle as well, depending on the type that we are prescribing. And that's how we manage those that we are doing smile makeovers who have the parafunctional habit of grinding and clenching their teeth.
So thank you for, this is actually such a beautiful, I would say, synergy between both professions, focusing on the same issue, grinding the teeth. Now, Dr. Steven, for someone like myself, for instance, is veneers a better option or Invisalign? Just to use myself as an example, I think it's easy for people to relate this way.
Sure. So in your case, I would want to straighten your teeth first. So many times we have all these different treatments. Sometimes one treatment versus another, they're not really fighting each other. They're actually working very synergistically together. The question is the order of which treatment should go first and which one should go after. Other times a treatment could take care of all of our chief complaints in that one treatment, and you don't really need both of them. So like in a case of a patient who has really overcrowded teeth, they're like really overlapping each other, there's a great benefit to straighten these teeth before I would go ahead and try to place veneers. And there's two major benefits to get these teeth straightened prior. One is going to be that when teeth are overlapping, it's hard to maintain and clean. It's also constricting the gum line right at the bottom where it's overlapping, which could lead to recession and problems with the gums. So masking these teeth, reshaping them, and in the front, everything looks straight, but behind they're still like this, really not helping anyone, right? And the longevity of the work, it's all about the foundation, and we didn't really fix that. So in those situations, I would say let's straighten the teeth. Maybe we don't have to go the 9th mile to get the teeth exactly straight as we would want, because we're about to do veneers anyways, but let's get it healthier. Let's get the gum tissue healthy. Let's maintain that bone level. Let's get the teeth in a better position so that we don't have to actually cut the teeth as much to make them look straight. For somebody that has slight relapse from Invisalign or past braces, or someone who has only minor spacing or only minor crowding, the teeth are kind of happy in that situation. They're slightly, touching each other a little too much inappropriately, but that's okay, because by just doing some small modification of the enamel, we could get that straight appearance. And from behind, they're in an okay position to maintain by flossing, brushing, and taking care of the teeth. So in that situation, I would not recommend going and trying to straighten these teeth the ever small amount just so that we could go to the veneers. We would term that instant orthodontics by the fact that the 2 weeks that it would take for us to prepare the teeth and put veneers onto the teeth, somebody could have some mild orthodontic issue, and all of a sudden now everything looks and feels straight.
Wow, that's quite fascinating. So when I see people on Instagram rushing to get veneers, again, let an expert, like a really amazing doctor, decide what you need, because sometimes we think everybody wants veneers these days, but you could probably fix the problem easier with just straightening your teeth first. So now going back to Dr. Z. Dr. Z, for people with veneers, do you treat their lips differently than with people who don't wear veneers in terms of getting a lip filler?
No, I don't treat their actual lips differently, but the last thing I want to do is treat the lips and make them look gorgeous, and then the next day they're going to a dental appointment. So I try to balance the timing, because I'd like if they're having a lot of dental work done, get your dental work done, then come in, because we don't want to, malposition anything or increase any chance, potentially though remote, of any infection. The other thing that we notice going along the line of teeth, that sometimes when people get the wisdom teeth extracted, that you lose bone. So you're losing some of your mandibular bone, some bony reabsorption with time. And we were talking about the master making things smaller, but sometimes we have to add filler to the cheeks or to the jawline to compensate for some of the bony reabsorption associated with previous dental extractions.
Wow, this has been so fascinating. And actually we have a surprise, a wonderful offer for our followers. And I will briefly actually read what packages we have. So I will start with Dr. Steven. We do have a fantastic combination. Usually teeth cleaning is $325, Zoom whitening $975, paraffin hand treatment $150, dental checkup $500. So instead of paying $2,075, the patients will have the amazing opportunity to go for $1,300 until September 7th, Labor Day weekend, and get basically all these procedures and ensure that they start September with that amazing healthy smile. Now for Dr. Z, we do have a surprise as well. One syringe lip filler is usually $800. One syringe filler for the lines, smoker lines, right, is $800, and Botox for the smoker lines $200. So instead of $1,800, the patients will have the amazing opportunity for $1,300 to get that gorgeous smile back on track, get ready to kill this pandemic. So thank you so much for everyone who tuned in. Thank you so much to the wonderful Dr. Steven, to the amazing Dr. Z, who makes me smile all the time. And I'm looking forward to seeing you soon because as you can see, I need some work too. Stay tuned and please follow us on Instagram. I will be posting a lot of details regarding Dr. Zweifler, Dr. Steven on my feed, in my stories. And please do not hesitate to DM me, DM Dr. Zweifler or Dr. Steven with any concerns and issues you want to mention, any problems that you might have, or just simply to smile with us. Enjoy the rest of your week and see you soon.